Hi everybody, welcome back to the Saginaw Chippewa Indian Tribe of Michigan. My name is Jason George. In our last video, we talked about employee COVID-19 screening and what to do based on your temperature reading. If you pass the screening process, you will need to be aware of the new workplace practices. Today, our topic is about coronavirus workplace hygiene. Let's talk about what the new reality is when working here. There are 5 things. First, we need to be aware of our physical distancing. COVID-19 spreads person to person, and the minimum distance for everyone is 6 feet. Second is everyone needs to wear a face mask, both associates and guests. Third is wash your hands, which is good advice anywhere for anyone. Fourth, don't touch your face, eyes, nose, and mouth. Lastly, if you feel sick, stay home and get tested for COVID-19. These are simple rules to follow and will keep us all safe while we do business during this pandemic. As a word of note, these guidelines are basic in general for most positions. Some departments will have additional guidelines, additional personal protective equipment, and more detailed procedures that will be shared and trained in your particular department. Physical distancing is a simple and effective mechanism to help prevent the transmission of COVID-19. We are employing the rules of physical distancing where we maintain a distance from each other of 6 feet or more. We are pretty certain that COVID-19 predominantly spreads by infected individuals coughing or sneezing in close proximity to healthy individuals. The moisture droplets or expectorants that are forced out in the cough or sneeze float around in the air, and we become infected by inhaling it, absorbing it, or ingesting it. The main thing is that we continue to exercise the physical distancing so that we can start to calm this epidemic down. Implementing the following efforts into your workday will help to protect you and your coworkers. Reasonably avoid coming within 6 feet of other individuals. Watch for visual cues that reinforce distancing in common areas. No handshaking or embracing coworkers or visitors. Avoid anyone who appears to be sick or who is coughing or sneezing. Avoid touching surfaces by others to the extent feasible. Respect barriers and distances between workstations. Avoid shared use of offices, desks, telephones, and tools, equipment, to the extent possible, and disinfect between uses. Limit the number of employees at one time in small office areas such as break rooms, copy machine rooms, file rooms, etc. Be aware of distances in elevators, smoking areas, and hallways. Bring lunch and eat away from others. Meetings should be conducted virtually or via phone when possible. Along with physical distancing, we need to continue to wash our hands. This is similar to how we treat flu season. Use soap and running water for at least 20 seconds. If you're not sure how long 20 seconds is, you can hum the Happy Birthday song twice. If you don't like the Happy Birthday song, then you can sing Old MacDonald's Farm. But the point is to wash your hands for 20 seconds underwater, cold or warm. Keep in mind that we are really good about washing our palms and the back of our hands, making sure that we spend time on our fingertips and in between our fingers. If you're in a situation when you can't wash your hands, remember, hand sanitizer works well as long as it contains 60% alcohol, and cover your hands well and keep rubbing till you feel it's dry. All employees are expected to wear face masks at work as follows. When walking through public hallways, including utilization of restrooms. If someone enters your office or workspace, both parties should wear masks. During in-person meetings. Tribal Operations Associates will be provided a mask for the purpose of work. Here's how to properly put on and take off your surgical mask. This is a simple mask to put on. You will notice it has an internal metal bar that will mold around the bridge of your nose and 2 loops that go around your ears. You place the mask over your nose, secure it over both ears, and shape it to fit. Make sure the mask covers your chin as well, spreading it around your face. What you don't do once you have your mask in place is touch your face. The mask is a good reminder not to touch your nose and mouth. If you do touch your mask, you should immediately sanitize your hands. Use hand sanitizer. When it is time to take off your mask, you want to do that again without touching the front of your mask, which is providing you with protection and theoretically the dirtiest part of the mask. So you remove it by grasping the loops around your ears and slowly and carefully taking it off and disposing it in a trash receptacle. As COVID-19 testing happens, we're finding out that not everyone displays symptoms in the same manner, and some are asymptomatic. They don't show symptoms at all and feel fine even though they are infected. This risk alone is reason enough for all of us to wear masks as the pandemic unfolds around us. Wearing a mask will help those who are unknowingly infected reduce the likelihood of COVID-19 transmission, as well as keep safe those who don't have it yet. There are a number of departments that will be provided gloves for work, and as you get to your departments, you will be notified if you and your department will be required to wear gloves for the purpose of your duties. Avoid touching your eyes, your nose, your mouth, or anything along those lines. Your eye is essentially a big sponge, and that particular sponge will absorb different viruses and bacteria and things of that nature. This is something you need to be mindful of at work, at home, and even in public, that you will come into contact with many things that will likely have been in contact by other people. We can't tell who is sick and who isn't, especially when time is applied to your activities. COVID-19 is microscopic. We can't see it, so best practice is to have as little contact as possible and don't touch your face, nose, or mouth. In the event that you become sick with COVID-19, the World Health Organization recommendation for people with severe symptoms such as high fever, bad cough, and difficulty breathing, seek medical attention and don't come into work. As for people with mild symptoms, the World Health Organization recommendation is self-isolate, tell your manager, and contact a doctor or COVID-19 hotline. Remember the 5 things we went over earlier. Physical distancing, wear a face mask, wash your hands, avoid touching your face. If you are sick, stay home. Again, welcome back. We are looking forward to seeing you again here at Saginaw Chippewa Indian Tribal Operations. Miigwech.